Welcome. In this session, you'll tackle 50 of the most frequently missed NCLEX questions on infection control and PPE sequencing. These are the concepts that often determine whether a candidate passes or fails because they test your ability to apply safety principles in real clinical situations, not just memorize isolation precautions. Expect realistic clinical scenarios covering standard, contact, droplet, and airborne precautions, the correct PPE donning and doffing sequence, hand hygiene, multi-drug-resistant organisms, MRSA, VRE, CRE, Clostridioides difficile, tuberculosis, measles, influenza, neutropenic precautions, and more. Read each question carefully. Choose the best answer before the rationale is revealed, and pay close attention to the subtle details that NCLEX loves to test. Let's begin and strengthen one of the most important patient safety topics you'll encounter on exam day. Question 1. A nurse on a medical surgical unit is assigned 4 newly admitted clients. During morning rounds, the infection prevention nurse observes the RN preparing to enter the room of a client diagnosed with pulmonary tuberculosis. The nurse performs hand hygiene, dons a disposable isolation gown, puts on gloves, and reaches for a surgical mask before entering. The patient is coughing frequently and has not yet been placed in a negative pressure room because maintenance is still preparing it. Which action by the nurse requires immediate correction? A. Performing hand hygiene before donning PPE. B. Wearing a surgical mask before entering the room. C. Donning gloves after putting on the gown. D. Planning to limit unnecessary equipment inside the room. Answer: B. Wearing a surgical mask before entering the room. Rationale: pulmonary tuberculosis requires airborne precautions. An N95 respirator, or higher-level respirator, is required before entering the room. A standard surgical mask does not adequately filter airborne droplet nuclei and places the nurse at significant risk of infection. Question 2. A client with confirmed Clostridioides difficile infection has frequent episodes of profuse diarrhea. After administering medications, the nurse removes the gloves, performs hand hygiene using alcohol-based sanitizer, removes the gown, and exits the room. Which action should the charge nurse correct? A. Removing gloves before the gown. B. Using alcohol-based hand sanitizer after caring for the client. C. Wearing both gown and gloves. D. Performing hand hygiene after glove removal. Answer: B. Using alcohol-based hand sanitizer after caring for the client. Rationale: C. Difficile spores are not reliably destroyed by alcohol-based hand sanitizer. Hand hygiene must be completed using soap and water after glove removal to physically remove spores from the hands. Question 3. A nurse prepares to enter the room of a client diagnosed with bacterial meningitis. Which PPE sequence is most appropriate before entering? A. Gloves, mask, gown, goggles. B. Gown, mask, goggles / face shield gloves. C. Gloves, gown, goggles, mask. D. Mask, gloves, gown, goggles. Answer: B. Gown, mask, goggles / face shield gloves. Rationale: the correct order for donning PPE is gown, mask / respirator, goggles, or face shield, gloves. This sequence minimizes contamination and ensures each item is properly secured. Question 4. A nurse exits the room of a client on contact precautions for MRSA. Which PPE removal sequence is correct? A. Gloves, goggles, gown, mask, hand hygiene. B. Mask, gloves, gown, goggles. C. Gloves, mask, gown, goggles. D. Goggles, gloves, mask, gown. Answer: A. Gloves, goggles, gown, mask, hand hygiene. Rationale: the most contaminated items are removed first. Gloves come off first, followed by eye protection, gown, and mask outside the room when appropriate. Hand hygiene is always performed immediately after PPE removal. Question 5. A newly licensed nurse is caring for a client with influenza requiring droplet precautions. Which statement indicates correct understanding? A. The client should be placed in a negative pressure room. B. I should wear an N95 respirator for every interaction. C. A surgical mask is required when entering the room. D. The room door must remain closed at all times. Answer: C. A surgical mask is required when entering the room. Rationale: influenza requires droplet precautions. A surgical mask is appropriate. Negative pressure rooms and N95 respirators are reserved for airborne diseases unless aerosol-generating procedures are being performed. Question 6. A nurse caring for a client with disseminated herpes zoster reviews the isolation requirements before entering the room. Which precaution should the nurse implement? A. Standard precautions only. B. Contact precautions only. C. Airborne and contact precautions. D. Droplet precautions. Answer: C. Airborne and contact precautions. Rationale: disseminated herpes zoster requires both airborne and contact precautions because the virus can spread through airborne particles and direct contact with lesions. Question 7. During medication administration, a nurse accidentally touches the outside surface of the contaminated gown while removing gloves. What is the priority nursing action? A. Continue removing PPE and perform hand hygiene afterward. B. Immediately perform hand hygiene before touching any clean surface. C. Replace the contaminated gloves. D. Remove the face shield first. Answer: B. Immediately perform hand hygiene before touching any clean surface. Rationale: if contamination occurs during PPE removal, immediate hand hygiene helps prevent transmission to the environment or the nurse's face and clothing. Question 8. A client with suspected measles arrives in the emergency department. Before laboratory confirmation, which precaution is most appropriate? A. Standard precautions. B. Contact precautions. C. Airborne precautions immediately. D. Droplet precautions only. Answer: C. Airborne precautions immediately. Rationale: measles is highly contagious through airborne transmission. Airborne precautions should begin immediately based on clinical suspicion without waiting for laboratory confirmation. Question 9. A nurse prepares to transport a client receiving airborne isolation to radiology. Which action is appropriate? A. Leave the client unmasked to avoid respiratory distress. B. Place a surgical mask on the client during transport. C. Require all staff in the hallway to wear N95 respirators. D. Remove isolation precautions once the client leaves the room. Answer: B. Place a surgical mask on the client during transport. Rationale: clients on airborne precautions should wear a surgical mask during transport to reduce transmission. Staff receiving the client should continue appropriate airborne precautions. Question 10. A nurse is caring for 4 clients. Which client should be assigned the highest infection control priority? A. A client with localized shingles covered by dressings. B. A client with untreated pulmonary tuberculosis coughing blood-tinged sputum. C. A client with postoperative cellulitis receiving antibiotics. D. A client with chronic hepatitis B awaiting discharge. Answer: B. A client with untreated pulmonary tuberculosis coughing blood-tinged sputum. Rationale: untreated pulmonary tuberculosis presents the greatest immediate transmission risk because it spreads through airborne particles that can remain suspended in the air and infect others. Question 11. A nurse in the emergency department receives report on 4 clients awaiting room assignments. Due to limited isolation rooms, the charge nurse asks which client requires placement in a negative pressure room first. Which client should the nurse prioritize? A. A 67-year-old with influenza who has a productive cough and fever. B. A 24-year-old with suspected varicella, chickenpox, and diffuse vesicular lesions. C. A 72-year-old with MRSA in a postoperative wound. D. A 19-year-old with norovirus experiencing vomiting and diarrhea. Answer: B. A 24-year-old with suspected varicella, chickenpox, and diffuse vesicular lesions. Rationale: suspected or confirmed varicella requires airborne and contact precautions and should be placed in a negative pressure room immediately. Influenza requires droplet precautions, MRSA requires contact precautions, and norovirus requires contact precautions. Question 12. A nurse enters the room of a client receiving droplet precautions for bacterial meningitis. While administering medication, the client begins coughing forcefully, spraying respiratory secretions onto the nurse's face shield and gown. Which action should the nurse take after leaving the room? A. Remove the face shield first, then gloves. B. Remove contaminated PPE using the recommended doffing sequence and perform hand hygiene. C. Wipe the face shield with alcohol while continuing to wear it. D. Remove the mask before removing the gown. Answer. B. Remove contaminated PPE using the recommended doffing sequence and perform hand hygiene. Rationale: PPE contaminated with body fluids should be removed carefully in the correct sequence to avoid self-contamination. Hand hygiene is required immediately after PPE removal. Question 13. A nursing student asks why gloves do not replace hand hygiene. Which instructor response is most accurate? A. Gloves eliminate the need for washing hands after patient care. B. Microscopic defects and contamination during glove removal can transmit microorganisms. C. Hand hygiene is necessary only if gloves become visibly soiled. D. Double gloving eliminates the need for hand hygiene. Answer. B. Microscopic defects and contamination during glove removal can transmit microorganisms. Rationale: gloves reduce exposure but are not foolproof. Hands can become contaminated during glove removal or through tiny glove defects. Therefore, hand hygiene remains essential. Question 14. A client with active pulmonary tuberculosis requires emergency intubation. Which PPE is most appropriate for the nurse assisting with the procedure? A. Surgical mask and gloves. B. Gloves only. C. N95 respirator, eye protection, gown, and gloves. D. Face shield only. Answer. C. N95 respirator, eye protection, gown, and gloves. Rationale: intubation is an aerosol-generating procedure. Full airborne PPE, including an N95 respirator, eye protection, gown, and gloves, is necessary to minimize exposure. Question 15. The nurse is preparing assignments for 4 clients requiring isolation. Which client can safely share a semi-private room with another client who has the same diagnosis? A. 2 clients with laboratory-confirmed influenza. B. A client with pulmonary tuberculosis and another with COVID-19. C. A client with measles and another with chickenpox. D. A client with MRSA and another with VRE. Answer. A. 2 clients with laboratory-confirmed influenza. Rationale: clients infected with the same confirmed organism may be cohort when private rooms are unavailable. Clients with different pathogens should not share rooms. Question 16. While removing PPE after caring for a client on contact precautions, the nurse's bare hand accidentally touches the contaminated outer surface of the gown. What is the priority action? A. Finish removing all PPE before cleaning the hands. B. Immediately perform hand hygiene before touching anything else. C. Put on another pair of gloves. D. Disinfect the gown before removing it. Answer. B. Immediately perform hand hygiene before touching anything else. Rationale: once contamination of bare skin occurs, immediate hand hygiene is the priority to interrupt transmission. Question 17. A client with respiratory syncytial virus, RSV, is admitted to the pediatric unit. Which precautions should the nurse implement? A. Airborne precautions. B. Contact and droplet precautions. C. Standard precautions only. D. Protective, reverse, isolation. Answer. B. Contact and droplet precautions. Rationale: RSV spreads through respiratory droplets and contaminated surfaces. Both contact and droplet precautions are recommended. Question 18. The infection prevention nurse observes several staff members removing PPE after caring for clients in isolation. Which action requires immediate intervention? A. Removing gloves before leaving the patient's bedside. B. Performing hand hygiene after PPE removal. C. Adjusting an N95 respirator with contaminated gloves. D. Rolling the gown inside out during removal. Answer. C. Adjusting an N95 respirator with contaminated gloves. Rationale: touching the respirator with contaminated gloves transfers microorganisms directly to the face and respirator, increasing the risk of self-contamination. Question 19. A nurse is caring for a neutropenic client following chemotherapy. Which action is appropriate to reduce the client's risk of infection? A. Encourage visitors with mild cold symptoms to wear masks. B. Restrict fresh flowers and potted plants from the room. C. Place the client in a negative pressure room. D. Require the client to wear gloves continuously. Answer. B. Restrict fresh flowers and potted plants from the room. Rationale: fresh flowers and plants can harbor fungi and bacteria that pose a significant risk to immunocompromised clients. Protective, positive pressure measures, not negative pressure rooms, are used for severe neutropenia. Question 20. During a busy shift, a nurse finishes dressing changes for a client with VRE. Without removing gloves, the nurse reaches into a medication cart to retrieve supplies for another patient. What is the most appropriate interpretation of this action? A. Acceptable because the gloves are intact. B. Appropriate if the cart is cleaned afterward. C. Incorrect because contaminated gloves should never touch clean equipment or supplies. D. Acceptable if alcohol-based sanitizer is applied to the gloves. Answer: C. Incorrect because contaminated gloves should never touch clean equipment or supplies. Rationale: contaminated gloves can transfer multi-drug-resistant organisms to medication carts, equipment, and other patients. Gloves must be removed, followed by hand hygiene, before touching clean surfaces or supplies. Question 21. A nurse is assigned to care for 4 clients during the day shift. To minimize the risk of transmitting microorganisms between patients, the charge nurse asks the RN to determine the safest order in which to provide direct care. Which sequence is most appropriate? A. Client with Clostridium difficile, client with MRSA wound, client recovering from chemotherapy-induced neutropenia, client receiving airborne precautions for tuberculosis. B. Client recovering from chemotherapy-induced neutropenia, stable postoperative, client without infection, client with MRSA wound infection, client with Clostridium difficile. C. Client with tuberculosis, client with neutropenia, client with influenza, client with MRSA. D. Client with MRSA, client with neutropenia, client with C. difficile, client with influenza. Answer: B. Client recovering from chemotherapy-induced neutropenia, stable postoperative, client without infection, client with MRSA wound infection, client with Clostridium difficile. Rationale: when possible, nurses should care for the most immunocompromised or cleanest patients first, and those with known infectious diseases last. C. Difficile is typically cared for last because of the high risk of environmental contamination and spore transmission. Question 22. A nurse enters the room of a client on contact precautions for carbapenem-resistant enterobacterales, CRE. While wearing gloves, the nurse answers a ringing personal cell phone and then continues providing patient care. Which statement best describes this action? A. Acceptable because gloves protect the phone. B. Appropriate if the phone is disinfected at the end of the shift. C. Incorrect because personal devices become contaminated and can transmit organisms outside the isolation room. D. Acceptable if gloves are changed before leaving the room. Answer: C. Incorrect because personal devices become contaminated and can transmit organisms outside the isolation room. Rationale: cell phones frequently become contaminated when touched with gloved hands and can spread multi-drug-resistant organisms throughout the healthcare environment. Question 23. A nurse is preparing to collect a nasopharyngeal specimen from a client with suspected COVID-19 who is coughing continuously. Which PPE provides the greatest protection during specimen collection? A. Gloves only. B. Surgical mask and gloves. C. N95 respirator, eye protection, gown, and gloves. D. Face shield only. Answer: C. N95 respirator, eye protection, gown, and gloves. Rationale: because specimen collection may provoke coughing and aerosol generation, enhanced respiratory protection with an N95 respirator, eye protection, gown, and gloves is appropriate. Question 24. A client with active pulmonary tuberculosis must leave the room for a CT scan. Which nursing intervention is most appropriate? A. Remove all PPE before transport. B. Place a surgical mask on the client during transport and notify the receiving department in advance. C. Delay the CT scan until the client is no longer infectious. D. Ask the transporter to wear only gloves. Answer: B. Place a surgical mask on the client during transport and notify the receiving department in advance. Rationale: patients on airborne precautions should wear a surgical mask during transport, and receiving departments should be notified so they can prepare appropriate precautions. Question 25. A nurse notices another nurse removing PPE in the following order: gloves, mask, gown, hand hygiene. Which observation should prompt correction? A. Gloves should not be removed first. B. The gown should be removed before the mask. C. Hand hygiene should occur before removing the gown. D. The mask should always be removed inside the patient's room. Answer: B. The gown should be removed before the mask. Rationale: the gown is generally removed before the mask because it is heavily contaminated. The mask is removed last or after leaving the room when appropriate, to protect the respiratory tract until exposure has ended. Question 26. A nurse caring for a client with scabies prepares to enter the room. Which PPE is required? A. Surgical mask only. B. N95 respirator only. C. Gloves and gown. D. Face shield only. Answer: C. Gloves and gown. Rationale: scabies spreads through direct skin-to-skin contact and contaminated linens. Contact precautions require gloves and a gown. Question 27. A nursing student asks why alcohol-based hand sanitizer is not recommended after caring for a client with Clostridioides difficile. Which instructor response is best? A. Alcohol causes skin irritation. B. Alcohol does not reliably destroy bacterial spores. C. Soap contains antibiotics that kill spores. D. Hand sanitizer is ineffective against all bacteria. Answer: B. Alcohol does not reliably destroy bacterial spores. Rationale: C. Difficile produces spores that resist alcohol. Washing with soap and water physically removes spores from the hands. Question 28. A nurse enters the room of a client receiving droplet precautions. During care, the client's oxygen tubing disconnects and sprays respiratory secretions toward the nurse. Which PPE item most directly protects the mucous membranes of the eyes? A. Gloves. B. Gown. C. Face shield or goggles. D. Shoe covers. Answer: C. Face shield or goggles. Rationale: eye protection prevents infectious droplets from contacting the conjunctiva, an important portal of entry for pathogens. Question 29. An RN delegates room cleaning after discharge of a client with Clostridioides difficile infection. Which statement by the environmental services worker indicates the need for further education? A. I'll use the facility-approved sporicidal disinfectant. B. I'll pay special attention to frequently touched surfaces. C. A standard quaternary ammonium cleaner is enough for this room. D. I'll wear gloves and gown while cleaning. Answer: C. A standard quaternary ammonium cleaner is enough for this room. Rationale: routine disinfectants may not kill C. difficile spores. EPA-approved sporicidal disinfectants are required for effective environmental decontamination. Question 30. A nurse has just completed wound care for a client with vancomycin-resistant enterococcus, VRE. Before leaving the room, the nurse realizes a stethoscope used during the assessment is still around the neck. What is the most appropriate nursing action? A. Remove the stethoscope and use it on the next patient. B. Disinfect the stethoscope according to facility policy before using it with another client. C. Wipe the stethoscope with a dry towel. D. Place the stethoscope in the medication room without cleaning it. Answer: B. Disinfect the stethoscope according to facility policy before using it with another client. Rationale: reusable equipment can transmit multi-drug-resistant organisms. Shared equipment, including stethoscopes, must be cleaned and disinfected according to facility policy before reuse. Question 31. A nurse is preparing morning medications for 4 clients. While reviewing the medication administration record, the nurse learns that one client has newly tested positive for Clostridioides difficile. The nurse is scheduled to administer medications to all 4 clients within the next hour. Which action best minimizes the risk of cross-contamination? A. Care for the client with C. difficile first to complete isolation tasks early. B. Administer medications to the non-infectious clients first and care for the client with C. difficile last. C. Wear 2 pairs of gloves while caring for every client. D. Use alcohol-based hand sanitizer immediately after leaving the C. difficile room. Answer: B. Administer medications to the non-infectious clients first and care for the client with C. difficile last. Rationale: Clients with highly transmissible infections should generally be cared for last whenever possible. After caring for a client with C. difficile, the nurse should remove PPE and wash hands with soap and water, as alcohol-based hand sanitizer is not effective against spores. Question 32. A nurse enters the room of a client with suspected Ebola virus disease after receiving specialized training. During care, the nurse notices a tear in one glove. What is the nurse's priority action? A. Continue care until the procedure is completed. B. Immediately stop patient care and safely replace the damaged PPE according to protocol. C. Apply alcohol-based sanitizer over the torn glove. D. Cover the tear with adhesive tape. Answer. B. Immediately stop patient care and safely replace the damaged PPE according to protocol. Rationale. A torn glove compromises the protective barrier and significantly increases exposure risk. Damaged PPE must be replaced immediately using approved doffing and donning procedures. Question 33. A client with suspected meningococcal meningitis is admitted to the emergency department. Before laboratory confirmation, which type of isolation is indicated? A. Standard precautions only. B. Contact precautions. C. Droplet precautions. D. Airborne precautions. Answer. C. Droplet precautions. Rationale. Suspected meningococcal meningitis requires droplet precautions immediately because respiratory secretions can rapidly spread the organism before diagnosis is confirmed. Question 34. A nurse observes an assistive personnel, AP, removing PPE after caring for a client on contact precautions. The AP removes the gloves, then immediately answers the hallway telephone before performing hand hygiene. Which action should the nurse take? A. No intervention is needed because the gloves were removed. B. Instruct the AP to perform hand hygiene immediately after glove removal before touching environmental surfaces. C. Clean the telephone after the shift. D. Tell the AP to wear double gloves next time. Answer. B. Instruct the AP to perform hand hygiene immediately after glove removal before touching environmental surfaces. Rationale. Hands may become contaminated during glove removal. Hand hygiene must be performed before touching any clean surface or shared equipment. Question 35. A client with severe neutropenia asks why everyone entering the room is asked to avoid visiting if they are ill. Which response by the nurse is most appropriate? A. Your medications make infections impossible to treat. B. Because your immune system is weakened, even minor illnesses can become life-threatening. C. Visitors are the main source of hospital infections. D. Wearing gloves completely prevents infection. Answer. B. Because your immune system is weakened, even minor illnesses can become life-threatening. Rationale. Clients with neutropenia have significantly reduced ability to fight infection. Even common viral illnesses can progress rapidly and become severe. Question 36. A nurse is caring for a client with localized herpes zoster, shingles. The lesions are completely covered, and the client has a normal immune system. Which precautions are appropriate? A. Standard precautions. B. Airborne precautions. C. Airborne and contact precautions. D. Droplet precautions. Answer. A. Standard precautions. Rationale. Localized shingles in an immunocompetent client with lesions that remain covered requires standard precautions. Disseminated disease or immunocompromised status requires airborne and contact precautions. Question 37. A nurse removes PPE after caring for a client on droplet precautions. Which item should generally be removed last? A. Gloves. B. Gown. C. Eye protection. D. Surgical mask. Answer. D. Surgical mask. Rationale. The mask is typically removed last, after leaving the patient's immediate environment when appropriate, to protect the nurse's respiratory tract until exposure has ended. Question 38. A nursing student asks which infection requires both contact precautions and soap and water hand hygiene after patient care. Which response is correct? A. Influenza. B. Pulmonary tuberculosis. C. Clostridioides difficile. D. Bacterial meningitis. Answer. C. Clostridioides difficile. Rationale. C. Difficile spores resist alcohol-based hand sanitizer. Contact precautions and hand washing with soap and water are essential after patient contact. Question 39. The nurse is preparing to insert a central venous catheter at the bedside. Which PPE combination provides maximum sterile barrier protection? A. Sterile gloves only. B. Sterile gloves and surgical mask. C. Sterile gloves, sterile gown, cap, mask, and large sterile drape. D. Clean gloves and face shield. Answer: C. Sterile gloves, sterile gown, cap, mask, and large sterile drape. Rationale: maximum sterile barrier precautions reduce the risk of central line-associated bloodstream infections, CLABSIs, during central venous catheter insertion. Question 40. The infection prevention nurse audits staff compliance with hand hygiene. Which situation requires hand hygiene even if gloves were worn throughout the procedure? A. After removing gloves following wound care. B. Before leaving the nursing station. C. Before documenting in the electronic health record while still in the patient's room. D. After putting on a clean isolation gown. Answer: A. After removing gloves following wound care. Rationale: hand hygiene is always required after glove removal, as gloves may have microscopic defects and contamination can occur during the removal process. Question 41. A nurse is caring for a client with confirmed measles who must be transported to the operating room for an emergency procedure. The transporter arrives without respiratory protection. What is the nurse's priority action? A. Cancel the procedure until the client is no longer infectious. B. Place a surgical mask on the client. Ensure staff caring for the client wear appropriate airborne PPE and notify the receiving department before transport. C. Cover the client with a blanket to reduce airborne spread. D. Allow transport because the client is leaving the isolation room. Answer: B. Place a surgical mask on the client. Ensure staff caring for the client wear appropriate airborne PPE and notify the receiving department before transport. Rationale: clients with measles require airborne precautions. During transport, the client should wear a surgical mask, and the receiving department should be notified in advance so airborne precautions can be maintained. Question 42. A nurse enters the room of a client receiving contact precautions for MRSA. After removing PPE correctly and performing hand hygiene, the nurse realizes a pen used during documentation remained in the uniform pocket throughout the visit. What is the nurse's best action? A. Continue using the pen because it remained in the pocket. B. Disinfect the pen according to facility policy before using it with another client. C. Throw the pen away immediately. D. Wash the pen with soap and water only. Answer: B. Disinfect the pen according to facility policy before using it with another client. Rationale: frequently handled personal items such as pens may become contaminated during patient care. Reusable items should be disinfected according to facility policy before reuse. Question 43. A nurse caring for a client with suspected pulmonary tuberculosis develops a persistent cough several weeks after repeated workplace exposures. During the review, the infection prevention nurse discovers the RN frequently performed a user seal check incorrectly when donning the N95 respirator. Which conclusion is most appropriate? A. Gloves provide enough protection against airborne diseases. B. A poorly fitted or improperly sealed respirator reduces protection against airborne particles. C. Surgical masks provide the same protection as N95 respirators. D. Hand hygiene alone prevents airborne tuberculosis transmission. Answer: B. A poorly fitted or improperly sealed respirator reduces protection against airborne particles. Rationale: an N95 respirator must be properly fitted and sealed to provide effective protection against airborne pathogens, such as tuberculosis. Question 44. A charge nurse observes a newly licensed nurse entering a client's room, wearing gloves, but failing to perform hand hygiene before putting them on. Which explanation best supports the need for hand hygiene before donning gloves? A. Gloves are sterile only after hand washing. B. Hands may contaminate the inside of the gloves during application. C. Gloves eliminate microorganisms on the skin. D. Hand hygiene is optional if gloves are worn. Answer: B. Hands may contaminate the inside of the gloves during application. Rationale: Hand hygiene before donning gloves reduces the transfer of microorganisms to the inside of the gloves and lowers the risk of contamination. Question 45. A client with extensive burns is admitted to the burn unit. The nurse emphasizes meticulous hand hygiene and strict aseptic technique to new staff. Why is this intervention especially important? A. Burn clients cannot develop bacterial infections. B. Loss of skin integrity greatly increases the risk of serious infection. C. Burns require only standard precautions. D. Infection occurs only after skin grafting. Answer. B. Loss of skin integrity greatly increases the risk of serious infection. Rationale. The skin is the body's primary barrier against microorganisms. Extensive burns significantly increase the risk of local and systemic infections. Question 46. A nurse is preparing to care for a client diagnosed with impetigo that has extensive draining lesions. Which transmission-based precaution should the nurse implement? A. Airborne precautions. B. Contact precautions. C. Droplet precautions. D. Protective isolation. Answer. B. Contact precautions. Rationale. Extensive draining skin infections such as impetigo require contact precautions to prevent transmission through direct contact with drainage or contaminated surfaces. Question 47. A nurse enters the room of a client with influenza wearing a surgical mask. During assessment, the client requires emergency endotracheal suctioning. What should the nurse do before performing the procedure? A. Continue wearing only the surgical mask. B. Replace the surgical mask with an appropriately fitted N95 respirator and use additional recommended PPE if available. C. Remove the mask because suctioning is brief. D. Wear gloves only. Answer. B. Replace the surgical mask with an appropriately fitted N95 respirator and use additional recommended PPE if available. Rationale. Endotracheal suctioning is an aerosol-generating procedure. An N95 respirator, eye protection, gloves, and gown are recommended to reduce exposure. Question 48. A nurse notices that an assistive personnel cleans a blood pressure cuff used on a client with VRE, using only a dry paper towel. What is the nurse's priority response? A. No intervention is necessary. B. Instruct the assistive personnel to clean and disinfect the equipment using the facility-approved disinfectant before reuse. C. Place the cuff in another client's room. D. Wash the cuff with plain water only. Answer. B. Instruct the assistive personnel to clean and disinfect the equipment using the facility-approved disinfectant before reuse. Rationale. Shared patient care equipment can transmit multi-drug-resistant organisms. It must be cleaned and disinfected according to facility policy before being used for another client. Question 49. A nurse removes gloves after emptying a urinary drainage bag and immediately reaches for a clean urinary catheter kit without performing hand hygiene. Which statement best describes this action? A. Appropriate because gloves were worn. B. Acceptable if the catheter kit remains unopened. C. Incorrect because hand hygiene is required after glove removal and before handling clean supplies. D. Appropriate if new gloves are applied immediately. Answer. C. Incorrect because hand hygiene is required after glove removal and before handling clean supplies. Rationale. Hand hygiene must be performed after glove removal because contamination can occur during glove removal. Clean supplies should never be handled with potentially contaminated hands. Question 50. During a Joint Commission infection control audit, a nurse is asked which intervention is most effective in preventing healthcare-associated infections, HAIs, across all patient populations. Which response is correct? A. Wearing gloves for every patient encounter. B. Routine administration of prophylactic antibiotics. C. Consistent and correct hand hygiene before and after every patient contact. D. Wearing an N95 respirator throughout the entire shift. Answer. C. Consistent and correct hand hygiene before and after every patient contact. Rationale. The single most effective intervention for preventing healthcare-associated infections is proper hand hygiene. Correct hand hygiene significantly reduces the transmission of pathogens and remains the cornerstone of infection prevention in all healthcare settings. Excellent work completing all 50 questions. Infection control is one of the highest yield areas on the NCLEX because every nursing specialty depends on preventing the spread of infection and protecting both patients and healthcare providers. Review any questions you missed, especially the isolation precautions, PPE sequencing, and hand hygiene principles. Repetition is the key to mastering these concepts, so revisit challenging scenarios until you can answer them confidently without hesitation. If you found this practice helpful, continue with another set of challenging NCLEX questions to keep building your clinical judgment and test-taking confidence. Every question you practice brings you one step closer to passing the NCLEX. Keep studying, stay consistent, and believe in your ability to succeed. You've got this.